Hello, this is the last part of the chapter on equality that we are dealing. Okay, we have seen various kind of scene depicting inequality in society in real life as in the fiction, or let's say in the Constitution of India. Okay, the last part 5 subtopic carries healthcare and equality. Why there is division in healthcare? Healthcare, do you understand? Huh? Like inequality in healthcare means the sickness in our body or disease in our body or imbalance. Okay, take that is known as healthcare. We have to care our health for fitness, as in this pandemic we are caring our health by staying at home. So this is the easiest way to um, care our health, without going outside we can heal ourselves. So is adequate healthcare available to all? There is a big question. It is. Yes or no? See, healthcare comes with two things, that is private sector and public sector. In private sector there are lots and lots of facility, whereas in public sector there are less facility with high disease. Why it takes place in our society, how we deal with it, and why it is important to be taken care of this kind of uh, you know inequality in our society, because we believe that we are more number where we cannot afford good medical health care, good medical state of mind, and good, there are blockages of ways where we cannot have unequal of healthcare, right? We'll see in further this chapter. Now we see that there is a division in private sector versus public sector. It is not a competition, it is a comparison between the private service and public service. How it is creating a difference between, the service that is provided to the same person, but like there is no outcome, you know, in a good way to the same persons. So let's see what happens. Why it is not having a good service is that where we have, and why it is happening is increasing concentration in urban area, rural area and urban area. This is urban area means city area, okay, where we see opposite to rural area. Rural area means the village area where we don't get that much of facility, but the agriculture is more in rural area and cities are more in urban area. So difference between the rural and urban area is understood by you, I really hope. Okay, so let's see, the costs in high medicine are expensive. So the high medicine are expensive, meaning thereby is like this form or sector. Let's take an example. So this is a hospital, this is a private sector, okay, and it's a hospital. Here we see that the their system, the design, or let's take the machine of treating the people, they are differently able to cope up with the patient. Their system is very understandable, and they have very much more expensive things and expensive medicine, okay, which is not like carried by public sector, means the sector that is come like below the middle class, okay. Due to this, many poor people cannot afford and have to borrow money for treatment, like the story we see of Kanta. She borrowed money from her landowner, okay, where she asks extra money to for the treatment of her daughter. So let's see that poor people are not able to afford that kind of treatment, okay, like expensive hospital, expensive treatment, expensive medicines. So this is below their average. So let's see more. Private sectors services encourage incorrect practice to earn money, prescribing expensive medicine, injection or saline not even required. So private services encourage incorrect practice to earn more. They really charge even sitting for a while. When we go to a private service, even we sit for 10-15 minutes, they ask for the money. And the meditation, level of meditation is very high. They pay much more charges for the prescriptions given by doctor, and the injection and saline not even required, meaning thereby is even we don't need, okay, even we say that it is enough for us, we can't afford, or let's say it is enough, this can be, this can, this is much more, but then they just forcefully give and they just take a charge on it that this has happened and you have to pay for this. So the kind of forceful or this kind of over, I think over dramatic system is this. If you're providing some service to a people, you should have this courtesy that you find them in a same scale, or at least people have to have a chance, no, that they can afford or certain things. But in private sector we don't get that, whereas in public sector everything is free, only less amount of medicine is less amount of medicine is there and we can afford. But there is much more problem, like lack of doctors, beds are insufficient, unhygienic, there is lacks of doctor, nurses, and people, they usually sleep on the floor, they are not able to get a bed, and they are not treating well because there is only countable doctors. So if there is much numbers of patients are there, then they are not able to take care of them. It is very clear. Even if we see by ourselves, we also feel that okay, this is like sufficient, this kind of thing is we should have practiced. So it is normal, it is normal, we see things in a normal way these days because it is practice and it is increasing day by day. We have lots and lots of numbers of private hospitals, private doctors, private cabin, okay, but we don't see such things in public sector. Here you can see this is public service and this is private. How difference is there is a vast difference. Here we see multiples of bed with design wall, but here you can, okay, we don't want design wall, but then at least have a sufficient bed, but here it's not available. So, and here also the same case, some mattress is given to them and they are provided to sleep on the floor, whereas here it's more number of machine and more number of AC is also here, and this scan camera I guess, and lots of bed. And here let's see, so there is picture depicting a lots of voice itself. Only 20% of the population can afford all the medicine. It is very correct that only half of the people, that also I think the rich people and half of the middle people who really want to cure fast and have good amount of money, that is useful for them, right? And only 40% of the people who is admitted to hospital for some illness injuries, they borrow money, like in the story of Kanti we saw, right? Why it is happening? We'll see here. Due to poor. How people become poor? Due to uneducation. Okay, uneducation, and there are more number of population, and there is lack of sanitation. Poor are like what to say, they are linked with illness and poverty due to not having this kind of sanitation at home or cleanliness at home, and expensive. They are like rarely they arrange food for themselves, then how could they have the proper medicine? At least government should look after their healthcare and eating habits. Malnutrition problem is there, like nowadays children are facing undernutrition, eating less, no basic things, they are no more likely to fall ill. So they will fall ill if they don't eat things in a correct way and they don't have a hygienic place to stay, then they will have a problem. So I really hope that part 1, 2, 3, 4, 5 really helped you a lot, and it is very crystal clear. If I am not wrong, then the whatever the question that I have given and whatever the things that I have been suggesting you, I believe that you have done, as I really know that you all are good students. So let's see here, what is the difference between private sector and public sector. I just said you many things that is being divided in a society, and you have to mention, you can like look after your dispensary, or you can ask your four grandfathers or grandmother or your mother father, what kind of thing, or you, if you are allowed, then you can visit and you can find the difference in reality itself. Okay, bye, take care.